Cardiopulmonary resuscitation. This is a life-saving skill that you as a parent need to learn. So what is CPR? What is cardiopulmonary resuscitation? Well, cardio stands for heart, pulmonary stands for lung, and resuscitation means to bring back to life. This is something that you're going to do on a child or an adult when they're breathing or their heart has stopped. It basically buys you time until medical personnel, such as paramedics, can arrive. So again, it's breathing and heart beating. That's what we're going to control here. Now, the most common reason in a child to stop breathing are respiratory issues, such as choking or drowning or a respiratory infection. Now, the key is acting quickly. You need to have this skill kind of under your belt and know what to do when the emergency arises. This means taking a class, learning online. You can find these classes through the Red Cross or through the YMCA, but you need to take a class before the emergency arrives. So let's talk a little bit of points. And we're going to go over the points of CPR, but this in no way replaces a class. We're going to go over the points, but again, taking a class is key. Call the YMCA, look online for the Red Cross, find a class in your area. So the first thing to do, and we're talking about a limp or an unconscious child, a child that you think might be dead, the first thing to do is check for alertness. Pick the child up. You want to shake it a little bit. Wipe its face, rub its face, shout at it, yell at it. Wake this child up. If the child does not respond, you need to assume the child has stopped breathing and that the heart has stopped beating. And the first thing you're going to do is compressions. For a little child less than about a year of age, you're going to place the child on its back, take 2 fingers, and you're going to do the compressions. This is getting the blood flowing in the baby's body. You take 2 fingers and place it on the child's breastbone, just below the nipple line, not down at the bottom, but just below the nipple line. And then you're going to do the compressions. You're going to push down rapidly, about 1/3 to 1/2 the depth of the child's chest. Push rapidly and push hard, quick and hard, about 30 times. This is the compressions. Now, if it's an older child, greater than about a year of age, you're going to use the heel of your hand. Again, the same position, kind of between the nipple lines, just below the nipple line, not down at the bottom, just between the nipple lines. Again, 30 compressions, about 1/2 the depth of the child's chest, about 30 times. Less than a year of age, 2 fingers. Greater than a year of age, up to about 8 or so, you're going to want to use the heel of your hand. You next need to breathe for the child. You need to open the child's airway. This is taking your hand, lifting the child's chin, with your other hand pushing back on the child's forehead. You now want to deliver what are known as 2 breaths. You can look to see if the child's breathing. If the child's not breathing, you're going to place your mouth over the child's, if it's an infant, small child, over their nose and mouth and deliver 2 breaths. If it's an older child, you can pinch off their nose and just put your mouth over their mouth and deliver 2 breaths. What you're looking for, and you can kind of see it out of the corner of your eye, is really for the chest rise. 2 breaths. You're then going to go back and do the chest compressions. Little babies, 2 fingers, 30 compressions. Older kids, heel of the hand, 30 compressions, about 1/2 the depth of the chest. 2 breaths, and then compressions. We used to, years ago, talk about looking for a pulse. We now know that's really inaccurate and really just wastes of time. If this child is limp and unconscious and you can't get them to wake up, you have to assume that their heart and their breathing has stopped. Some newer things is what's called hands-only CPR. We now know for older people they really don't have to do the breathing. It's all about the compressions. But this does not apply to babies. Kids less than a year of age, for children, you need to still do the breathing, not just the compressions. So 30 compressions and 2 breaths. Keep alternating back and forth. You should have called 911. If 911 has not arrived, you need to go get someone to call 911. In children, the teaching is if you find your child unconscious, you want to do at least 2 minutes of CPR. 30 chest compressions, 2 breaths, 30 chest compressions, 2 breaths for a full 2 minutes before you leave your child to call 911. So if you come across a child who's limp and unconscious, have someone call 911. Point to someone to call 911. If you're alone, do 2 minutes of CPR before you leave your child to go call 911. This is a life-saving skill that you really need to take a class. We just wanted to go over some points of CPR, but taking class, there's nothing like it. Unfortunately, there's a lot of classes in your area. Look online, talk to your pediatrician, call your Red Cross, or call the YMCA.